back to San Antonio Living. People are dealing with weight loss in different ways these days. There's several options out there, and one of those options is bariatric surgery. It's become a very popular way for those people who need to lose a lot of weight to do it. In fact, I've got two friends who have had bariatric surgery, so we wanted to get you the most information we could on this subject. So we brought in two doctors this morning. Dr. Keith Wright is joining us, and Dr. Gerardo Carcamo, both with the South Texas Surgeons. Thank you so much for coming today.
Thank you. Thank you.
This is something that has really gained a lot of steam. I think I've got two girlfriends who both had bariatric surgery. It's something that we talk about when we go out to dinner or when we go out. And I think a lot of people are learning more and more about bariatric surgery and looking at it as an option to losing weight. Do you think that's the situation out there?
Well, sure.
Why is it good for some people to choose bariatric surgery?
Well, you know, the problem lies in the fact that obesity is such a bad problem to have. I mean, obesity leads to lots of medical problems, like diabetes, high blood pressure, coronary artery disease, and so forth. And you need to treat the root of the cause. And if you treat the obesity, many times the obesity problems go away. And that is why it's a good idea if you are not able to lose weight on your own. If you have to, you try diets, you try exercise, but are not willing to, you know, give up, then weight loss surgery should be something you should consider.
And the problem is that once the obesity gets to a certain level, once you reach a certain number of pounds overweight, the amount of exercise and dieting that is required is really just not feasible for most people, and there really hasn't been anything proven either with medications, exercise programs, or diets that has been proven as effective as surgery for weight loss in those patients.
And this isn't a decision that people make quickly. It requires a lot of counseling, a lot of sitting down with a doctor to find out who really would benefit from a surgery like this.
Correct.
Who would benefit? What kind of situations do you need to have?
Well, the NIH has certain criteria that they use for weight loss surgery, and these were established back in 1991. And they include weight as characterized by body mass index, which roughly correlates to about 100 pounds, 75 to 100 pounds overweight. The weight that's acceptable for surgery is a little bit lower if you've got associated medical problems like diabetes, high blood pressure, sleep apnea.
And today we're talking about the lap band specifically.
Correct.
How does that work?
Well, the lap band, we have a model here to show you, and I have something to pass around. Basically, what this is a silicone band that's placed around the top of the stomach. This is done with surgery laparoscopically with small incisions, and as you can see, the inside of the band has a little inflatable cuff where we can adjust this device in the office. And we can inject saline into a little port, and what that does is inflates the cuff around the top of the stomach to decrease the effective size of the stomach, decrease your portion sizes, help take away hunger in between meals.
So basically, instead of trying to fill up a stomach that's this big, you're trying to fill up a stomach that's this big, which immediately means you have to eat less, right?
Absolutely. You get full quicker with a smaller amount of food, and it allows you to stay satisfied longer so you don't feel like you're torturing yourself on a diet all day. Dr.
Carcamo, how long does a surgery like this take for someone to undergo?
Well, it typically takes about 30 to 45 minutes to do. It's not a long operation, but we always have to make sure that the person is ready to have the operation, that the heart and lungs and everything else is okay for the operation. So.
And what kind of follow-up after you have the surgery are you looking at?
We recommend very close follow-up afterwards. This is an adjustable device, so unlike other weight loss surgery procedures where you have the surgery and you're pretty much done, with the lap band you need to adjust the device in order to get it to where it's acceptable for you, where you're eating a small portion, you're satisfied with that small portion, you're not hungry between meals, and you're losing weight at an appropriate rate, which should be about 1 to 2 pounds per week.
Wow, that sounds very good. What about the rest of your life? Once you've changed your eating habits and you've gotten down to the weight that you want to be at, is the lap band then removed, or is it something that you keep with you?
The lap band is meant to be a permanent device. It is reversible. We can remove it if we need to, but almost universally, if we take the band out, the patient will regain the weight. There's a reason that the band was put in there, because that patient's metabolism is very, very efficient at hanging on to energy, and we're not changing anything about the patient's genetics or metabolism. We're just adding a tool to help them eat smaller portions without being hungry.
If folks are at home right now and they're watching this and this sounds like something that they might be interested, what kind of questions should they be asking their doctors? Who do they need to talk to?
Well, the first thing I would do is attend an informational seminar.
Okay.
And we have these in our office a couple of times a week where we go through complications, other surgical options to really educate the patient as much as we can, give patients an opportunity to ask questions, and we also have some of our own patients there. So that's where I would start.
Start with the education, get the
Sure.
most information you can, and then find out if you fit the criteria for the surgery. All right, if you would like some more information about South Texas surgeons, you can find them on Navarro Street. The information is there. You can try the website. It's stxsurgeons.com, or call this number for more information, 1-866-463-5499 or 210-220-1726. You can also try the Nick's Weight Loss Surgery Center. Again, nicksweightlosssurgerycenter.com for more information, and there's a phone number there for you as well.